So I wonder if that has implications kind of as Christians, as pastors. I feel like a lot of the response that I've been seeing from Christians is, hey, this will be over soon, or God will protect us. And as more Christians start getting sick, or as kind of the uncertainty around how long this is going to be with us, I wonder if maybe we need to start shifting the way we talk about it. Like George, from your perspective, what are some ways that I guess, what are things that you think Christians should be? How should Christians be talking about coronavirus and addressing, addressing lockdown and quarantine and things like that, from your perspective in mental health?
I think from my perspective, I think one of the, we have to, in certain parts of the world, we have to go through, right, a quarantine. We have to go through a lockdown. Of course, here in China, where it started, to various degrees, we had to all go through this. But I think as Christians, what we can do is we can actually push a different narrative, right? What is God trying to do, right? That's positive through this. What is God trying to show us? What is God trying to do in my heart? Right, and maybe what that is trying to see how we can help our fellow man, our fellow brother and sister, how we can live out the gospel, right, in this context. I think that, science, non-Christian science, right, has shown us that one of the protective factors from a lot of the negative symptoms that result from either this issue or others is an others-focused mentality, right? That Jesus modeled for us, from the beginning, right? And I believe really that because we are all under and subject, right? And, as part of God's creation, the mental health science and the mental health data really, follows our created design, which is that what protects our mental health is an others-focused mentality. So what is God, how can God use me? How can God use us, whatever the us is, my family, my church, my small group, my community? How can God use us to be a blessing to other people? And I think that could be a huge focus. Instead of how are my rights being restricted? How am I being negatively impacted? Right? As real as those things are, right? As real as the negative impact is, whether that's physical or financial or emotional, right? We should also expand our thinking to include what is God trying to do through me, in this situation. We should include that as well.
For sure. Yeah, I mean that almost is so basic that it's kind of funny that it needs to be said explicitly, but no, that's so true. I mean,
yeah, it needs to be said because you know what, like fear is powerful now. Fear, and this virus, right? Like, talk about like triggering fear, and fear and insecurity are what humans do not do well with, and Americans don't do well with, right? We are not used to, as Americans, feeling all that fearful, right? We've never fought a war in our own territory since what? The American Revolution, right? I mean, we fought a civil war. We've fought plenty of stuff outside, but we've never been threatened, ourselves. We, especially our generation, we don't, we grow up in this bubble, right? And now there's this unseen, invisible pathogen out there, and people are scared, and people respond to that fear by closing up, right? Protecting me, right? And closing that circle as much as possible. To some extent, that's necessary, right? We need to social distance, right? Because we don't want to be breathing and coughing on each other and spreading whatever it is. So that makes sense to some extent. But we also have to come out, at least mentally, out of that and say, all right, in my context right now, how can I bless others? How can I love others? What does God want to do through me?
I have a quick follow-up question.
Yeah.
Well, I completely agree with this what we can tell the church and how we can like kind of interpret what's going on to Christians. But I mean, I'm assuming that you probably have non-Christian clients as well, and so
Yeah.
for in that case, especially for those like actually suffering, how are we, or how do you, I guess, kind of translate what's going on in like a hopeful way? But I mean, sometimes you can't mention God because that wouldn't make sense to people without that context. So like,
Yeah, I mean, but it's in the exact same way that we're talking about. Like what
Yeah.
I do is I try to separate truth from lie, and I try to introduce what I call cognitive flexibility, right? Like, right? How can we view things flexibly, right? You think
Yeah.
this is fearful and that you've been restricted and that your life is horrible or whatever, but what's another way to look at it? How can we break out of that negative cycle and ask, is it really that bad? Is what I have concluded about this actually true? Right? Or what would it look like if what I have concluded about this is actually not true or not completely true? How would I act?
Yeah.
Right? How would I act if I were not the scared victim, but actually an agent of blessing, right? If you're a Christian, or an agent of positive change, or whatever, if you're not, right? Whatever we call it, right? What would that look like? How would I act? What would I be doing? Right? And that can introduce that flexibility into that person's mindset, right? At least a little bit. That can be that toe in the door, and then we try to like pull the door wider open.
Gotcha.
Is it the case that like in times of mental health challenges that people are more open or less open to like the idea of cognitive flexibility?
It's kind of both. Because like if we think about like it's kind of both, because I don't know if you guys heard of Maslow. Maslow has like this model of hierarchy of needs, right? Like the triangle, right? And so like people can start to think about their mindset and cognitive flexibility and outlook and perspective the more that they have the bottom layers kind of secure. Right.
They're
So
fundamental, like
physical
needs, right?
Yeah. So if you're sick, right, if you're in the hospital, in the ICU, on a ventilator, on a respirator, then like, all right, I think, right, we've got to handle the bottom layer first, right? And also if you, as maybe you felt threatened, like maybe you're helping one of your loved ones recover from the disease, or maybe a lot of people who got sick or passed away, or somebody in your family, maybe not you, but somebody close to you. And so there's a different sort of way that we can go about doing this. But it's both, right? People may be closed until they attain a certain level of security, right? So I think as Christians, we have to, you got to work the whole thing, right? You got to help people get to attain that security a little bit so that they can start thinking about these other things, right? So as Christians, I think we should also be, thinking about, okay, how can we help people who are sick? How can we help get equipment out to people, right? How can we start getting the bottom layers met so that people can start thinking about other things? And part of the other things is the gospel and what God is doing, and the reality that this virus is telling us about our world, which is maybe it's not so secure, right? Maybe it's not, and maybe the things that we've trusted in before, right? The things that we've trusted in before, maybe, I don't know, maybe they can't protect us as well as we thought, right? So who can, right?
That's really
what is
helpful.
the ultimate hope, right?
Yeah.
It's not this thing anymore. It's not even my life anymore,